Okay, today's checkoff is going to be colostomy care and changing bags, but first we're going to start with co-wipe, check physician's orders and allergies, assemble appropriate equipment, wash hands, identify the patient, introduce myself to the patient, and then provide for privacy and educate, explain, and evaluate. So first things first, we would wash hands, put on our gloves, and also help the patient to a comfortable and appropriate position. A lot of times this is much easier and more natural to do while they are like sitting on the toilet or the commode, but if they're not able to get up and do those things, of course we would just go ahead and do it in the bed. So I have my stoma site here. We would assess why it needs to be changed, the dressing and the wafer that is. Sometimes like facility policy says like, oh, once every few days or once a week or whatever. Or maybe it's just starting to come off, like maybe it wasn't put on very well the first time, or maybe the bag got too full and the weight started pulling it down. Whatever the reason is, we're gonna change it. So after we take off the old wafer, we assess the skin and clean it. Sometimes there are like special solutions to clean it, but for most people just using like warm, mild, soapy water is good enough. So you clean around the site, the skin, and then also you could get the stoma itself a little wet if you wanted to, but probably try to be a little careful not to get too much soap on the stoma itself because you just don't want to irritate it. But when I'm assessing the skin, I'm just looking to make sure there's like no crazy redness or breakdown. And then when I assess the stoma, making sure it's like that good red color, it's moist. If it was starting to turn blue or if it was darkening in color, like almost black, brown, I would definitely be calling a physician. But after the site's all cleaned up and everything looks good, we go ahead and measure around the stoma. We definitely don't want it too tight or too loose. Usually we just kind of want the site to be about 1/4 inch away from the stoma itself. So we would take this and place it up to the wafer to see where we need to cut. This stoma is about 1 3/4 of an inch. So this is already cut, but I would use my scissors and cut around it, smoothing out the edges to make sure I don't, irritate the skin by leaving any jagged edges on it. Sometimes you need to put a barrier cream or powder on the skin. It just depends. But after you do that, you would take off the adhesive and put the sticky side down, pressing firmly, making sure it's really on there. We don't want this coming off. We don't want it leaking because that's just not good or fun for anybody. Taking our clean bag, we would press firmly on it until we hear a click. And then at the bottom of these bags, they roll up and clip so none of the feces comes out. And then if for whatever reason we needed to irrigate due to constipation, we would do that too with warm saline or whatever solution that the physician orders. When you do that, you really want to make sure that you have like towels on hand and are probably in the bathroom doing that because a lot of times that causes a big mess. But after everything's all said and done, wash my hands, make sure the patient is safe, call light, in bed, all that good stuff, and then go document my findings.